Hi, I'm Mark Sweeney, owner and founder of Austin Dental Spa here in beautiful Austin, Texas. Let's talk about digital dentistry. I know you've heard the term, but some people are a little confused as to what digital dentistry is. Well, basically, it's the use of computers and digital technology just like you would use on your cell phone. But how does it relate to dentistry? Well, the first piece of technology I got that was digital, I was actually the first dentist in Austin, Texas to get digital radiographs. 1994 was when I first heard about them, and the idea of not having a dark room and little films that sometimes didn't develop correctly and you had to go back and take them over, and one of your employees spent a good bit of time in that dark room developing those films just didn't seem to make sense to me once I was exposed to the idea of digital dentistry. So I think I was the 16th dentist to buy the SCHIC system nationwide, and the first one in Austin, and possibly one of the first ones in the state of Texas. So since '94, we have been taking nothing but digital x-rays so that there's no films. If you want to transfer your x-rays from our office to another office, if you move to a different city, we can actually email those. And they can also be blown up on the screen so that you can see minor details in large format, whereas in the old film days, the dentist, I'm sure if you're old enough, you had a dentist hold up the x-ray up to the light and say, see that little dark spot right there? Well, it was just kind of lost on most people. They just took it for granted that we knew what we were talking about, but they weren't trained to read x-rays. Now, pretty much anybody can see it if it's blown up big enough on a TV monitor. They can tell where the problems are, where the bone levels are, where the issues are. Another big improvement is we put a CBCT unit, or a cone beam computerized technology into our office just last year, and it has been a total game changer. This machine, nothing goes in your mouth like the old digital sensors still go in your mouth like regular x-rays did. But this thing goes around your head in 14 seconds, nothing ever touches you, and a computer assembles all those x-rays that it's taking. The radiation is less than taking a full set of x-rays in the mouth, which used to involve 20 different views of different parts of the mouth. With the CBCT, we get either a Panorex view, which is a big, long, flat view, just like you can take with your iPhone, where you take a whole landscape, or it can actually do three-dimensional x-rays where the computer assembles these kind of like a CAT scan or an MRI. So we can actually see in all three dimensions every aspect of that tooth. And we're finding all kinds of things now with the 3D x-ray that we never were able to see with the 2D x-rays, extra canals inside of teeth that we never could have seen before. And so the technology is really pretty cool, and it gives us the opportunity to do a better job for our patients. Another place where digital dentistry has come in is with scanners that allow us to not have to use the gooey stuff, the impression material that used to go in your mouth when you had a crown done, or every orthodontist nowadays worth of salt has a digital scanner, especially if they're doing Invisalign. The camera goes in your mouth, they take a scan, and it goes to Costa Rica, and 2 weeks later, your orthodontic trays come back and they start moving your teeth. So it's really cool technology. Here in our office, we use a digital scanner whenever we're doing a crown on somebody, or multiple crowns. We can scan it, no goop goes in your mouth, so nobody gets choked up or gags. The scanner goes in, it's quick, it's painless, and it shows up on a computer, a digital scan, and then I can build the crown right on that digital scan, send it to a milling unit right down the hallway, and your crown is made in 15 minutes. Right here in the office, no 2 appointments. If you ever have had a crown done, you know that it used to be, until 10 years ago, it was a 2-visit procedure. You had to get numb 2 different times. One appointment, the preparation was done and a temporary was put on, and then you came back 2 to 3 weeks later, had to get numb all over again to have the temporary put off in the permanent crown. That's kind of a thing of the past most of the time, unless you're talking about a large smile makeover, anything more than 4 teeth. We do still with the old technology, but we're using the scans, but we still do put temporaries on. So it's increased the workflow considerably from dentistry so that things happen faster, quicker, and easier for the patient. So I hope that's been helpful for you.